A quick revision. So, the ocular movement is controlled by 10 muscles. There are 3 intraocular muscles and 7 extraocular muscles. So, there's one ciliary muscle, one sphincter pupillae and one dilator pupillae. All of these together are called the intraocular muscles, whereas extraocular muscles, there's one muscle that belongs to the eyelid, that's the Levator Palpabrae Superioris, and 6 muscles that are the famous extraocular muscles. These are the 4 recti and the 2 obliques, superior, inferior, medial and lateral recti, and then the superior and inferior oblique. So there are 3 intraocular muscles and 7 extraocular muscles. Now coming to the muscles of eyelid, for opening the eyelid, LPS is the most important, and secondary to it, the Muller's muscle and the Frontalis muscle, these 3 help in the elevation of eyelid. However, for closing the lid, only one muscle is in action, that is the Orbicularis muscle. Okay, for opening LPS, Muller's and Frontalis, and for closing it is Orbicularis. Now let's look at the nerve supply. We know we are all familiar with this mnemonic LR6 SO4 rest all by 3. That is, the lateral rectus is supplied by the 6th cranial nerve abducens, superior oblique by the trochlear or the 4th nerve, and all other remaining muscles supplied by the oculomotor or the 3rd cranial nerve. So, lateral rectus by the 6th, superior oblique by the 4th, and the others by the 3rd. Now, LPS is also supplied by oculomotor nerve. So, point to be noted, LPS is also supplied by oculomotor nerve. Let's look at the actions of these muscles now. Let's get familiar with 2 words. Duction is one eye movement, whereas version is both eyes movement. Now, place your left palm on your left eye and try to use only your right eye to look in all the 4 directions. Yeah? So, the movement that you're doing right now is termed as duction. You're using only one eye. Whereas version, when you use both your eyes to look from side to side, up and down like the Bharatanatyam dancers, that's called version. Okay. Now, elevation means moving up, depression is moving down, abduction is away from the center, adduction is inwards or towards the center, intorsion means rotating inwards like this. Suppose this is your left eye. Intorsion, the eye moves in this direction. Extorsion moves in this direction. Okay, that is extorsion, outwards, rotating outwards. Okay, so the medial rectus helps in adduction. See, like this. Please note this is the right eyeball. So the medial rectus will help in adducting the eyeball towards the center, and the lateral rectus will abduct the eyeball. That is, moves it away from the center. Now, an important and easy mnemonic to remember is SYN-RAD. By SYN, I mean all the superiors cause intorsion. That is, superior rectus and the superior oblique cause intorsion. Now, an extraocular muscle has 3 types of actions: the primary, the secondary, and the tertiary. We'll look at it in a little while. So, one of those functions of the superior rectus and the superior oblique is intorsion, whereas the inferiors cause extorsion. Okay, just the opposite of superiors. That is, inferior rectus and inferior oblique cause extorsion. Then the lateral rectus causes adduction and the oblique muscles cause abduction. Now let's look at these in detail. The actions, that is the primary, secondary and the tertiary actions. The superior rectus causes intorsion, adduction and elevation. You've seen superiors cause intorsion and the primary action will be elevation and the other one is adduction. That is RAD, that is the rectus causes adduction. Okay. Inferior rectus extorsion, adduction and depression. Superior oblique intorsion, abduction and depression, and inferior oblique extorsion, abduction and elevation. Another easy way to remember the actions of superior oblique is solid. SO stands for superior oblique, L is just to complete the mnemonic, I is for intorsion, D is for depression. Solid is for superior oblique. Now if you can just look at this picture for a little while and correlate the previous table, you can easily memorize all the movements of extraocular muscles. Now let's understand here the concept of agonist, antagonist and synergist. Agonist is the main muscle that helps in moving the eyeball in the primary position, in the primary gaze. Okay, that is an agonist. An antagonist, as you can guess by the name, it counteracts the agonist, and the synergist is the best friend of agonist, that is, it supports the action of the agonist. Okay, synergist supports, antagonist counteracts, and agonist is the main muscle in primary gaze. So let's take an example. For elevation, the agonist, you can understand by the name, it will be superior rectus, and antagonist obviously will be inferior rectus, and synergist will be your inferior oblique. Okay, and abduction will be obviously lateral rectus. Yes, the antagonist, yeah, that is medial rectus, and the synergists are two, superior oblique and inferior oblique. Now let's look at primary action. What do I mean by the word primary action? The action of the muscle in primary gaze. Okay, so primary action of superior rectus is elevation, that of inferior rectus is depression, superior oblique is intorsion, and inferior oblique is extorsion. These are the primary actions. Now that I have spoken about gazes, let's learn about cardinal gazes. And look at this picture. If you can just remember this picture in your exam, you will remember all the gazes. So this is the primary gaze, right? And these are the secondary gazes, secondary, these four, and these are the tertiary gazes. All right. Now let's look at them. So the primary is this straight vision, for secondary up, down, left and right. Okay, and for tertiary will be your up right, down right, up left and down left. Those are the tertiary gazes. Okay, and let's come to an interesting topic called the yoke muscles. So, by definition, yoke muscles are a pair of muscles from both the eyes. When they contract, the eyeball moves in the same direction. These are the two words that you need to remember, both eyes and same direction. Yoke muscle, one muscle belongs to right and one muscle belongs to the left side, always. So, look at your options before marking. Make sure it's both right and left. So, this a wooden piece that is connecting these animals is known as a yoke. It helps in moving the animals in same direction. Similarly, the yoke muscles function. So, right and left lateral will become medial. Just you have to make it opposite. Similarly, left and right lateral becomes medial. Okay. Now, right and left superior rectus, however, becomes inferior oblique. Okay. And left inferior rectus and right superior oblique. All of these are yoke muscles. Now, levo means left, dextro means right. We know that. So, levoversion is caused by left lateral rectus and right medial rectus. Dextroversion is caused by right lateral rectus and left medial rectus. Levo elevation is caused by left superior rectus and right inferior oblique, and dextro depression is caused by right inferior rectus and left superior oblique. Okay, it's very easy to remember. Once you go through it twice or thrice, you will be easily able to memorize all of these. Just a pictorial depiction of what we have seen just now. Levoversion. See over here. So the patient is looking towards the left side. So the yoke muscles are left lateral rectus and right medial rectus. Similarly, in dextroversion, the yoke muscles will be right lateral rectus and left medial rectus. Now, similar to this is levo elevation caused by your right inferior oblique and left superior rectus, and dextro depression caused by right inferior rectus and left superior oblique.
Hello everyone, this is Dr. Sai Suguna, your mentor for ophthalmology at Medicoapps.
Now, thanks for watching the video. Now we have put such videos all together in our ophthalmology app. The trial version you can download from the link over here or in the description box below.